Facing cancer can be overwhelming. How do you stay informed about your disease? How do you get help from others in your situation? How can you become part of the cure? HealthTree Foundation is how. HealthTree is a global nonprofit organization uniting patients and researchers through cutting-edge technology to work together on curing disease. HealthTree is already accelerating cures and is actively expanding its reach into all blood cancers. The HealthTree model is simply powerful, with cure tools in 3 primary areas or pillars that deliver on its mission. First, personalized lifetime support and education. Second, meaningful patient-to-patient connections. And third, a powerful patient data portal. Our first pillar is lifetime personalized support and education. It's a fact that educated patients live longer and have better quality of life. That's why HealthTree has an in-depth library of webinars, podcasts, news articles, and even an online university where experts share their knowledge. Plus, you can benefit from a supportive team of bilingual patient and medical navigators. HealthTree's second pillar, meaningful patient-to-patient connections, enables you to learn from others and receive vital support and information along your journey. Through HealthTree's coach program, volunteer coaches provide emotional and educational one-on-one support. This program alone has changed thousands of lives, bringing joy to both coaches and coachees. The coach program is available for our multiple myeloma and AML communities and will be coming to all other blood cancers soon. HealthTree has programs for underserved communities as well, providing equal opportunity for everyone to receive the very best medical care. HealthTree also offers regional cure teams, where you can connect with caregivers and other patients, learn from local specialists, raise awareness in your neighborhood, volunteer to support your peers, and fundraise for research. Our final pillar, the powerful patient data portal, is called HealthTree Cure Hub. Built on proprietary technology platform, HealthTree Cure Hub enables you to track your disease by linking your medical records from various facilities in one place, see your integrated medical labs, and discover potential treatments, and even review clinical trial options. You can even find and chat with someone with similar disease characteristics, or uncover crowdsourced solutions for your side effects. Ultimately, you can be a key part of accelerating a cure by participating in active studies that lead to faster findings and deliver real-world evidence for blood cancer researchers. In fact, HealthTree provides researchers with the most comprehensive, accurate, and continually updated set of research data available anywhere today. HealthTree Cure Hub opens doors for new types of investigator research, saving time and money on the road to finding a cure. Today, 14,000 blood cancer patients participate in HealthTree Cure Hub, and 65,000 blood cancer patients have taken surveys. These 3 pillars support the miraculous work of HealthTree around the globe and help keep patients and loved ones connected as they become active contributors in finding a cure. The HealthTree model is working every day on behalf of patients. We are now expanding the successful model to accelerate a cure for all other blood cancers. So when you get your diagnosis and you're trying to make sense of your new situation, rest assured there's a way forward, a way filled with hope, encouragement, and results. HealthTree is the way to a better outcome and a better life.
Hi, everyone, and welcome to today's webinar. My name is Cindy, and I'm the Multiple Myeloma Education Manager here at HealthTree. It means a lot to have you here today as we continue to grow HealthTree's blood cancer communities. At the end of today's webinar, we'll have a short survey where you can share your thoughts on today's session and suggest topics you'd love to see in the future. We're always looking to cover what matters to you most, so we'd really appreciate your feedback. Just a heads up, this meeting is being recorded and is also being live streamed to YouTube. For those joining us from YouTube, welcome. If you have any questions about today's presentation or would like to join in the live Q&A, join us over at healthtree.org and register for the event. Once you register, you'll receive a Zoom link and be able to join in and ask some questions. As we go along, feel free to drop any general questions or comments in the chat. We'll keep an eye on them. And then our presenter will answer all audience questions during the Q&A at the end. If you need help with any Zoom features, just let us know in the Q&A. We're happy to assist. To access the Q&A, you just tap on the Q&A button. Or if you are on a mobile device, you may either need to tap the three dots or just tap the screen and then the Q&A button. As always, we'd like to thank our sponsors without whom this event would not be possible: Pfizer, Adaptive, Cura, Johnson & Johnson, GSK, AbbVie, and Amgen. We're excited to hear once again from Diana as she presents some information for financial support for blood cancer caregivers and also Veterans Healthcare Program overview. We chose today's topic because we know both of those communities are often underrepresented. We don't get a lot of information out, and we want to make sure that you know what programs are available for you within the veteran support healthcare systems, and then also some financial support that's available strictly for our caregivers. We want to, of course, say thank you to our veterans that are joining us today. We really do appreciate you. And with that, I will go ahead and introduce Diana. Diana is the financial program manager specializing in financial help for multiple myeloma and AML patients. As a professional financial advisor and former caregiver of her husband, who is diagnosed with multiple myeloma, Diana perfectly understands the financial issues facing cancer patients. But I'll turn it over to Diana.
Good afternoon, good morning, wherever you may be. I'm kind of off kilter a little bit. I am here in Salt Lake City, and I'm actually 2 hours ahead of where I normally am. So I'm kind of trying to catch my footing. I'll get it right in time to get on the plane to go back home. But welcome to everyone here. I want you to look at this QR code because this QR code is very important. It's very important to connect you guys to not only other patients who may have similar issues and concerns that you may have, but it also links you to our Connect page where you will get the latest, greatest, scariest, whatever updates you need to have so you can make the best financial choices and decisions for you and your family. If you could please scan that and join our Financial Connect page. I know there's a lot of uncertainty out there, and I'm going to try to pull all this together. I'll do the work for you and show you some things and tell you some things as soon as I get confirmation of the information, the accuracy of the information, and put it out there so you can have that available to you. And I will try to do that as information comes in. So you can only get that information if you go through this scan and connect to our Financial Connect groups. Next slide. So things we're going to cover, what is caregiving? And you might be surprised at what caregiving actually is, and based on the way it's traditionally thought of. Learning from personal experience, I'll share with you one of the aha moments that I had in my caregiving or partnering with my husband. What you need to do, access to resources for caregivers, who to ask and what you need to ask, where to go. And, it's not just financial when it comes to caregiving, as anybody's a caregiver knows. Next slide. So for the veterans, we're going to cover the federal insurance program, where you need to go to help to understand your financial responsibilities. What if insurance isn't enough? You're going to get access to help where you can find help paying bills. Are there resources to help cover unpaid bills, financial counseling, and local assistance access that you have, resources you may have access to? Next slide. So, what is caregiving? And that could be answered, I guess different cultures will answer that question differently. But the caregiving definition that we have is a caregiver is a person who tends to the needs or the concerns of a person with short and or long-term limitations due to an illness, injury, or disability. So some of the responsibilities as a caregiver, this is probably not all inclusive of the things that you do to help someone. So some of the responsibilities of a caregiver could include providing assistance with the activities of daily living, which includes bathing, helping someone dress, helping them to eat, helping them use the restroom, helping them to groom themselves, and transferring from one place to another. There's also mobility assistance you might provide, such as support while walking, using walkers, wheelchairs, or other mobility devices, and ensuring a smooth, safe transfer. Next slide. And then there is health management. Now, this is probably not everything. I'm sure it isn't. There's medication management, which is a huge responsibility in and of itself. That's ensuring that medications are taken correctly at proper times and monitoring for side effects. And that, if you were like me, you may be getting up at night, helping with IV lines, giving medications during the middle of the night. So there's a lot of disruptions to normal living that you have to live with as well. Monitoring health conditions, observing changes in the care recipient's health, and reporting those concerns to the appropriate healthcare provider. This also includes assisting with medical appointments. And this is a very, very important aspect because you probably know that person better than anyone else. And so some of those small, minute things that may not be picked up on when perhaps you were at the doctor's office recently, you may pick up on those things, and those small things can be very important in making sure that person is getting the best care. Preparing and overseeing care plan. This might mean you might need to understand what the care plan is if you have to take a person back and forth to the doctor for blood draws or for blood scans or for treatment. You're going to be helping oversee and help manage their care plan that they actually get to their appointments that's needed. You can help implement it and communicate with healthcare professionals should something arise. The next slide. Now there's care partnering, and it wasn't until I guess the last that I actually fully appreciated what this meant. Um, but there's care partnering, and you may be able to distinguish the difference in what you're doing now, but maybe a little more information to help you understand when there's a need for care partnering, care and caregiving, and sometimes those two terms may overlap in how you're helping with someone, assist someone. Care partnering is a mutual and collaborative approach to care, and this can be fluid, goes back and forth as needed. The patient receiving the care and their support person work together as a team to address health and well-being needs. In contrast, caregiving usually is considered a one-way relationship where the care provider is seen as a primary decision maker. Now, some of the key aspects of care partnering may include shared decision making, whether that's what kind of treatment they're going to have, how you actually converse both or at the same time with your doctors, and also focus on your mutual support. Next slide. And that's mutual support, not just for the patient, but also for yours as well. It also includes individualized care. When you may need care for that person, it means they need their care and you need your individualized care too. You need self-care. Self-care is very important, very, very important when you're a caregiver or care partner. It also includes empowering yourself to be able to do the things that you would like to do with that person, empowering that other person so they can continue to live life, not just everything's evolved around the cancer. Also, it emphasizes on doing with a person, doing, join together, doing things together, versus doing for. When you have the for is the patient and you are specifically in that caregiving um, position. Care partnering benefits, there are benefits for both the individual and the care partner succinctly together. So some of the examples of care partnering, attending doctor's appointments together and discussing care options among yourselves, collaborating together on meal planning and grocery shopping, providing emotional support and encouragement during challenging times, using assistive technology together to promote independence, participating in activities and interests that both parties enjoy that you can still do together, whether that's going to a park, traveling together, going to movies, going on walks, all of those things that you both enjoy doing together, where you can get a lot of benefit, both emotionally, physically, all of those things can still be done together. The next slide. So share my personal experience because it was a big aha moment and a realization of what I had to do, not only to support and empower myself, but to support and empower my husband. So I really didn't understand the difference between caregiving and care parting until I was so overwhelmed with my husband's care, not sleeping. I'm a person who researched to death, which I did do. Um, and because I thought this was absolutely necessary, and the only way I knew how to do it to become very supportive of him. I thought that was the best way to support him. But what I was doing, I was becoming resentful, I guess, for my role, um, guilty for feeling resentful, guilty for not feeling like I was doing enough. And so it was a lot. I was too involved trying to make things the way I thought they should be because I was afraid of something might fall through the cracks with his care. And in doing so, I missed what my husband needed and wanted. And some quiet way he was kind of trying to confer to me, and I was not listening. So I needed to understand how to back up and allow him space to do what he wanted to do and could do without my interference. And it was hard. It was very hard, but quickly welcomed by both of us. He was able to take care of himself more and understand, take more empowering himself more versus always feeling like a patient. So next slide, I'll get to this last part in a little bit. So my husband, with all of his consideration and not bringing it up sooner, he was looking out for my care. He had the strength and the courage to actually make me understand one day. Maybe not the way I thought he should have, but it certainly was very effective. I walked in from work and I asked him, in a way that I always do, I thought it was innocent. I said, "How are you today and what have you been up to?" I'd asked that same question, I'm sure, hundreds of times, even before he was ill, without incident. But this particular time, he looked at me and said, "Stop. I'm fine. Cancer is only a small part of who I am and doesn't currently impede on my ability to think and to do." So I was stopped dead in my tracks. At first, I was hurt and more than a bit angry, because I'm putting out all this time and effort and all that. And why is he being so ungrateful? So I responded, "I was only asking about your day," and I huffed out of the room. I literally huffed out of the room. It wasn't until the next day, with this incident being the only thing I could think of, that I realized I was way too close at this point in his illness. He didn't need a caregiver. He was able to do most everything for himself. Next slide. In fact, I realized that I was making him a patient who could not care for himself, but he could. He really could. Instead of assisting him in things he needed help in. So, and there was a very few things at that point. I needed to make him aware that I was always there for him should he need me. I stopped going to all of his doctor's appointments. I stopped asking every day, what did he do that day? I didn't ask about his labs every week. I had to trust that he would bring that information to me when he needed and when he was comfortable with doing it. And he did. He would lay the lab works on my side of the kitchen table. At that point, I realized I became a care partner. I remained diligent in monitoring my actions as his cancer journey changed. He did need me more intimately involved in his care when he could not do so as much himself. And I realized when I stepped back, both physically and I don't know, I guess I was being very intrusive. I didn't think I was. In fact, I thought I wasn't doing enough. Things lightened up. I didn't feel resentful. I felt more what I it started out feeling. I felt honored to be the person that could take care of him, that could attend to the needs. And I just need to make sure that I wasn't making him the person that he wasn't. Next slide. When I did that, I found I had more time to take care of myself. When I said I wasn't sleeping sometimes, it was because of what a lot of times things I put up on myself. I took up to do myself. I didn't realize how much I'd taken on emotionally that was in fact impeding me helping him achieve his best care. There is an organization called ARCH that may provide resources for possible state and federal funding as well as private sources that may be available to help you pay for respite care. So if you are in the caregiving role, where you are, it's pretty much a one way where you're providing a lot of care for a person who really needs assistance in a lot of the day's activities of daily living, then I know it's overwhelming. It can be physically because you may help to move this person, to help bathe the person, to help dress that person. It's physically, mentally, and emotionally draining. And unfortunately, caregivers are lost. There are so many of us in the country, but they're lost. But there are organizations that can help you find respite care, both in your local community and federal and private resources may be available to you as well. I will list some other resources later on in our program, but I want you to know that stepping away, taking some time for yourself, does not make you a bad caregiver or care partner. It makes you a better caregiver and care partner because you're better able to fill your own fuel tank so that you may provide resources to them and so that you're not running on empty, which is eventually going to lead you to be have emotional issues, anger issues, um, physical issues, and that is not good for you, and it does not allow you to be the best caregiver, care partner that you can be. Next slide. So again, most people, including myself, have no experience with caregiving, especially the physical aspects of caregiving. So it is imperative that you ask your doctor or nurse what the expectations are, both now and what they may turn into, and if there's any training or assistance available to you. A lot of programs will train you on transferring a person correctly, so you won't end up with um, pains and strains and messing up your back, which is very, very important. You may be able to be even you may even be able to find financial resources available with the training that may pay you for that care partnering or caregiving of that patient. Although there are many aspects of caregiving, we are going to focus on the caregiver's needs for respite need, time off, and some possible financial resources that may be available to you. The next slide. So this is going to be is astounding. So who are the caregivers in the United States today? According to The Guardian, caregiving in the United States is on the rise. This is not something that's unexpected because our population is aging, with more than 100 million adults functioning as 100 million US adults functioning as caregivers, providing care for a child, parent, or other family member. Or more narrowly speaking, 53 million US adults caring for a spouse, elderly parents, a relative, or a special needs child. Many of these caregivers also try to maintain a full-time job. Can you imagine? And most of you, if you're a caregiver signed on, you understand just how difficult that is. Excuse me. So also, according to June 2nd, I know it's almost a year old, more than a year old, 2004. So these estimates are very, very rough. Arthur Lee, no, I'm sorry, this will be 2024. It was updated the following day. Estimate that 5.4 million kids under the age of 18 are caregivers to adults. And Connie Siskowski is the founder of a nonprofit American Association of Caregiving Youth, also thinks that that number of 5.4 is a gross underestimate of the number of kids under the age of 18 who are caregivers and sometimes full caregivers to adults. Imagining a kid trying to transfer an adult, trying to make sure an adult is clean, trying to make sure that person is dressed, make sure they get their medications. These are, I think this is horrendous. Um, she thinks that number of 5.4 would be closer to 7.5 million in our country. Like I said, it's a silent job. A lot of children and adults assume that responsibility, and no one may even know what they're doing. So I think the number on both sides for the adults and for the children is grossly underestimated. Next slide. So as we know, we heard since the pandemic, there's nurse in-home care and nursing homes are hard to find. There are fewer workers doing that. There are fewer facilities. And so again, even more since the pandemic has become very in our face with the lack of need out there. Then there's nothing out there in the way of federal government benefits to help pay for their caregiving, to help young caregivers. Often these young caregivers suffer not only physically, mentally, emotionally, because they're not with peers, they're not in school, they're not in outside physical activities. So it becomes a horrible challenge. And unfortunately, our country lacks in support for caregivers. Medicare does not pay for family members to provide care, and low-income families on Medicaid can be reimbursed only for adults. And we know Medicare, what does Medicare can provide if a family member owns Medicare, but they have other financial resources attached to their Medicare plan, may provide some kind of assistance, but generally it's not to help provide care. Medicare is not a long-term care facility, does not provide long-term care um, reimbursement. So family members giving any type of remuneration to a child can be disqualified from Medicaid. So you have a double whammy. You have a child who's helping support a family with giving care to an adult, maybe while the parents are working, which they need as well. And then that adult tries to give the child remuneration, or maybe that recipient of the Medicaid tries to give the child remuneration, because when they do that, they can be disqualified for Medicaid because they say that that remuneration can be used for your care. Well, it is being used for care, but not the way our Medicaid or Medicare's program wants it to be used. Next slide. So there may be state programs available to help you care for a family member, and I urge you all to reach out and find out through your you can call 211. They can help you find resources that may be local, that may be that states may provide that are in your area. So if you could also link to the HHS. And this may be a challenge because a lot of the programs through the HHS have been shuttered in the last 100 days of the new administration. And it's becoming more and more challenging to even work to talk to someone over the phone. So some state assistance can come in the form of federal programs, which are being reduced or eliminated completely, grants, and potential compensation through Medicaid waivers. Some of the waivers allow for direct payments to caregivers for eligible individuals. Federal programs like the National Family Caregiver Support Program provides grants to states for caregiver support. So I urge you to reach out to any of these resources, and again, be aware that HHS trying to access them as well as the Medicare department or Medicaid department may become a challenge because there are fewer workers, and it's just can be very overwhelming. But do be persistent. Next slide. Again, as a caregiver, care partner, you sacrifice a lot of time, of things you want to do or need to be doing. There's a lot of sacrificing that you don't do, and most people don't complain about it because this is when you do a vow or whatever they chose to do. And then most people take this as uh, a blessing to be able to take care of a person versus having someone else take care of them. If you've ever been a caregiver, you probably have a lot of other responsibilities as well, especially if you have children at home. You're managing all of their needs. Often you may find yourself falling into bed exhausted and having to start it all over again the next morning. Caregivers, unfortunately, in our country are often forgotten. So it's important to take care of yourself so that you can continue to assist others. Getting a respite or time off, if even for an hour, can do wonders to your psyche and help refill your energy reserves as well as your emotional reserves. I've found myself doing that reluctantly, but after I was forced into taking some time to myself, I realized just how much it re-energized me. Seek out help from church members or local adult daycares. People don't know that you need help and would love to help until you ask. Again, call 211 to find out what resources may be available to you locally. Next slide. So here's some additional resources for caregivers. The National Institute on Aging, VA.gov, Discovery Commons, and Senior Services of America. Those are just a few. If you Google resources for caregivers or care partners, you'll find a host of things, whether it's emotional support, getting some respite, getting help, finding out how you can get some training to becoming a caregiver and get some remuneration for that. There are resources available to most people. Next slide. For our veterans out there and the caregivers of veterans, was have found that a lot of veterans aren't aware of the benefits that may be available to them, even if it comes to their TRICARE, their healthcare benefits, and what those benefits may cover, or what may cover for their spouses. So I've spoken to more than a few veterans who were retired. Their spouses were working simply so that the spouse could keep their own insurance when they didn't realize that they could be on the veterans insurance. So there are a lot of benefits. I really, 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 really encourage you to reach out to the Veterans Administration to find out what kind of resources are available to you. If you go to a VA center, they should be able to hook you up with um, a social worker that can go over a lot of your benefits, both in hospitalization or out patient care, and that includes assistance for someone coming into your home, giving you assistance, whether that person be a licensed person, skilled person, or someone else. So, for some of the caregiver benefits that are eligible to you through the VA, you must be 18 years old and at least one of the following must be true to you. These are eligibility requirements for family caregivers. You must be a spouse, son, daughter, or extended family member of the veteran. You must be living full-time with a veteran or be willing to live full-time with a veteran if you are designated as a family caregiver. So this might put up a few roadblocks or some time constraints, but it's very important for them to understand who is actually going to be the caregiver, where you're going to be, and are you going to be a full-time caregiver in order for to get enumeration or for the veteran to get the assistance they require. Next slide. And all of the following must be true as eligibility requirements for the veteran. The VA has a disability rating, individual or combined, of 70% or higher, and the veteran was discharged from the U.S. military or has a date of medical discharge. And, next slide, the veteran needs at least 6 months of continuous in-person personal care services consisting of the following: assistance with health and well-being, everyday personal needs like life feeding, bathing, and dressing, safety protection or instruction in the daily living environment. A primary and a secondary backup family caregiver can be appointed by the veteran. And there are steps in order for you to do that. You just can't have someone else come in and start doing it. In order for this to run smoothly, for you to get the assistance or resources you need, there has to be paperwork that has to be done and has to be kept on file with the VA. Next slide. Eligible primary and secondary family caregivers can receive these benefits: caregiver education and training, mental health counseling, travel, lodging, and financial assistance when traveling with the veteran to receive care, even if that means going across state lines, especially if you don't have a specialist in the state you live in order to receive that medical care or whatever, you have to travel across state lines. A monthly stipend is a payment to the caregiver. Access to healthcare benefits through the Civilian Health and Medical Program of the Department of Veterans Affairs, or CHAMFA. If you don't already qualify for care services under another healthcare plan, that's what's important. If you don't already qualify for care service under another healthcare plan, such as you're employed and the employer has health care. If you had to stop working or you're stopping working to take care of that veteran and you lose your health care at your former employer, then there's no other way for you to get health care. Then you can get health care under the Civilian Health and Medical Program of the Department of Veterans Affairs. Next slide. Both the family caregiver and the veteran must apply together and participate in the application process together to determine the eligibility. Both parties need to sign and date the application and answer all pertinent questions for your role. There's going to be all kinds of questions, all kinds of verification, IDs, all that kind of stuff that you're going to have to provide to the VA. If the veteran is already enrolled in this program and want to add a new family caregiver as a secondary caregiver, a new application must be submitted. That's for the secondary family caregiver role. Next slide. And I would say that it's always a good idea to have a secondary family caregiver, um, because if that other person has to, go back to work or have other things that may interfere with their caregiving, it's always important to have a backup. So how do you apply for these benefits? You can go online at the va.gov. You can submit an application. The form is 10-10CG to the Evidence Intake Center, and there's the address, P.O. Box 5154, Janesville, Wisconsin 53547 and 51 at dash 5154. In person, find a caregiver support team through the Caregiver Support Program Teams directory. You can find that through caregiver.va.gov, or you can call the Caregiver Support line at 855-260-3274. And for TTY, that is 711. So you can do it in 4 different ways. Whatever is convenient for you, you can get that taken care of. Again, if you have a secondary, you'll need to fill this form out twice. Next slide. So VA benefits include a wide range of services and programs that a lot of veterans are not aware of. For eligible veterans and their families, these benefits can include healthcare, usually through TRICARE or TRICARE for Life. It provides a comprehensive range of services, including preventive care, inpatient care, and specialized care. It also provides disability compensation. This monthly amount is based on your disability rating and details about your dependent family members. Now, as a VA, there have been many different additional resources to add to your rating, your disability rating through the VA, with things like Agent Orange or all these other things you may have been exposed to through your service. I encourage you to always review that, talk to your local VA center, and find out if you are indeed taking advantage of everything that you can take advantage of with your disability compensation, making sure that you are at the highest disability based on your needs and where you are in your disability healthcare. There are programs for home loans, and they're not just one time, life insurance and burial benefits as well. So make sure you're aware of all of these things so that you have a file of these things, what things can change, when you can change things, so that your caregiver is aware of them as well, and they have easy access to those in your behalf. Next slide. So if you've lost your job, have had, I'm sorry, I've had some typos in here. I have one hand. Have had a sudden decrease in income, or your out-of-pocket expenses have increased, you may be entitled to financial assistance based on a hardship. So, out-of-pocket copay help, there are two options available to you. They're online and by mail. Here's the online web address link, and then you can fill out the VA form 5655 and state why you need assistance. You can go in person to find at your local VA office. You can find through this link where your local VA office is, and you can file that 5655 with them in person. So I will, with these typo errors, I will go in and correct those before this webinar is sent out to you guys. So I apologize for those errors. Next slide. So you can request help for debt relief. This is one of the areas in particular that a lot of veterans are not aware of available to them. You can request a waiver for all or part of the balance of an outstanding debt. If your request is accepted, your collections will be stopped and debt will be forgiven. Or you can make an offer to compromise the debt. If your offer is accepted and you are the one who's coming up with a compromise, and agreed upon smaller on-time payment can resolve the debt. So this is huge, especially now with credit card debt and all these other things going up. These are some things, and medical debt. These are some things you can look at, and you can have debt either reduced, stopped, and your debt can be forgiven. So that could be a huge weight off your shoulders. Next slide. You can set up a repayment plan to pay your bills over a period of time. Your proposed payment plan will be reviewed based on how much you owe and your ability to pay within a reasonable time. You are usually required to pay the balance in full within 3 years and your debt within 3 years. To set up a plan, fill out the VA form 1100. Don't forget to say how much you can pay each month. That's very important. You don't want them to come up with a number. You may have to provide supporting documents as well to verify your income and the amount of debt. These documents can be either mailed or taken to your local VA office in person. Again, see the previous slide for the links to find your local VA office. If you receive new charges, you will need to fill out a new VA Form 1100. For any additional new charges, they will not be automatically grandfathered in with your prior application. So you have to fill out one for new charges that you aren't able to pay. Next slide. If you receive new changes, you'll need to complete a new VA Form 1100. I want to reinstate that so people won't just have those charges out there sitting, thinking they're going to be taken care of. If your income has decreased and you won't be able to pay future copays, you can fill out the Form 10-10HS. And here's the link to do that. A hardship copay exemption doesn't apply to copays for pharmacy medications. You know that you need to be aware of that. Next slide. If you need more information or help with filling out your forms, remember some of these forms need to be done in tandem with the caregiver or partner who's going to be living with you in your home. You need to fill those out, sign and date those things as well. Call the VA at 866-400-1238 or TTY 711. They're open Monday through Friday, 8 a.m. to 8 p.m. Eastern Time. Next slide. So other information that you may need, if you need to dispute copay charges or you don't know what your copay rates are, you need to update your health benefit information or need help assessing your income to determine eligibility, visit the va.gov. They will be able to help you. There's links there for almost any question or concern you may have. Again, your local VA office will be able to help you as well. Next slide. So in summary, I know it's a lot. For caregivers, please review options that are available to you versus both for respite care, time off, and you should not ever feel guilty for that. They'll make you a better caregiver, care partner. Many states have income for family caregivers, and you need to review the eligibility requirements surrounding those. Review all of the options that are available to you. Also, don't forget to search for resources within your local community. 211 is, again, I'll say that over and again, 211 is a great resource. For veterans, I've noticed that many veterans are unaware of the resources that are available to them and their spouses. Please visit va.gov or visit your local VA office. Next slide. Here again is that please scan this code. You can go to join our Financial Connect group. We're reading like the latest information on what's going on in our world, which is very complicated, very unsettling, and there's a lot of uncertainty out there, but I want to provide you with the best information available so you can make the best decisions for you and your family. Again, it's an easy sign up to our Financial Connect group. And you can also link with other Connect groups to talk to people, connect with people who may have going through similar experiences that you may be going through. It's we see ourselves as a big family here, and we love to support one another. And if you don't have concerns and you want your caregiver to sign up, your caregiver can sign up as well. You can sign up for coaches, financial coaches, or coaches to help you through any of the concerns you have as a patient. We look forward to working with you, and we consider it an honor to be on your side. Thank you for joining us.
Perfect. Thank you so much, Diana. I really appreciate all the different resources you provided and information. I know there's a lot that I wasn't aware of. I watched a program recently that talked about Gulf War syndrome, and the particular person that was experiencing it wasn't taking advantage of his VA benefits. And I think it's so important. You've served the country, you've done your part in all of this, and we just want to make sure that you've got access to all of those resources. So thank you for making sure we've got those out there for our veterans. All right. So this is the Q&A portion. So if anybody has any questions, feel free to dump those into the Q&A at the bottom of the screen. And we will take just a few questions before we close out today. While we wait for a few to fill into our Q&A box, you used the word remuneration a few times. I'm wondering if you could just define that so people know what that was regarding.
Okay. Okay, thank you. That means pay. When you get income, it's remuneration is like cash in lieu of or because you're providing a service. When you get paid through your employer, that's a remuneration for the services or the job that you provide to them.
Perfect. Thank you so much. I'm learning a new word today. Thank you. Um, other next question I had was just the different resources that you listed specifically for care partners, 211, HHS, National Family Caregiver Support Program. We send out often our web page that you've built out with the different resources. Are those resources on that web page as well?
They may not be. I don't think they are. I have not done a lot for caregivers, unfortunately. I mean, I've done several webinars, but I can make sure that these things can be updated on our webpage. And this is not an inclusive list. There are quite a few things out there, especially locally, that you may not find in other states or other regions. I would suggest you Google your area, do that 211 call, and then look at the national or federal resources that be available. Now, I will tell you this, and we know that a lot of services are being cut back. Medicaid, Medicare resources are being cut back. So those things, they may be here today and gone tomorrow, and you may not know about it until the day before, or when you go and you're waiting for a check to come in, it may not be there. So that's why I said it's very important to scan that code, go to our Financial Connect, because I will be making you aware of all of these changes that could be, you know, at the middle of the night, they come down in the middle of the night and they're effective immediately. You may not know until the next day. So yes, there are a lot of resources out there. If I were to list everything out there, I cannot go through everything locally or even state, but you can Google those things and find those things available to you.
Okay, perfect. And as a reminder, we will send out the slides from today's program. And maybe before we send out the follow-up email, we can look through and see which resources we can add to that page. It's a wonderful running list, and I know people really appreciate that. So thank you. We've got a few questions in the Q&A, so we'll just start at the top and work our way down. First question says, I have a question regarding Medicare. I am turning 65 next year, and I am applying for Medicare, but I would like to continue with my husband's insurance as my primary insurance, which is very good. Furthermore, I am thinking of applying for Social Security disability since I have been in the hospital several times this year, and as I understand, I need to enroll to Medicare if approved. Can I continue with my husband's insurance as a primary insurance, even if I'm on disability?
There's a lot going on with that question.
Yeah.
Okay, so let's talk about the Social Security disability. If you have not applied for that, if you are on disability now, they can do a look back as to when you through your application process when you're actually considered disabled. I will tell you now, from the time that they receive all of paperwork, even if it's in good order, it could be up to 2 years before you get a decision. At that point, I mean, I would still do it because that's time that you are owed should you need it. Um, but it is taking time. And in the meantime, when you do that, if you were working and had to stop, also look at SSI. You apply apply for SSI and Social Security Disability at the same time. So you can have some income coming in prior to that Social Security Disability application being determined. The other thing is when you can, if your husband is continuing to work and you are covered under his insurance, you can continue to get his insurance and you don't have to apply for Medicare. However, if you're going to get, if you, if you want to have, you have pre-existing condition, it sounds like you may have that. Your Medicare supplemental program, which pays for what your traditional Part A and Part B, hospital doctor's appointments, things like that, would not cover, then if you're going to get a Medigap plan, which is the best, and doctors even tell you, it's the best options to go versus Medicare Advantage because you don't have the narrower networks. You have a broader network. Anywhere you go, if they take Medicare, they have to take Medicare plan no matter what it is. There are no pre-existing conditions. So you are approved guarantee issue when you are first eligible to sign up for Medicare. And first eligible is generally when you are disabled through Social Security disability, because you can get Medigap plans when you're before age 65 if you're disabled, or you're age 65. So even though you have covered under your husband's plan, it might be a good idea to get Part A and Part B. Part A is there's generally no cost. Part B, there's a cost, and it may be more depending what income is. But also look at that getting that Medicare part, that Medigap plan, because may not be eligible for it later on.
Okay, thank you so much. And if there's further questions with this, person that's asking me question, just a reminder, if you want to get into the HealthTree Connect, the Financial HealthTree Connect, Diana's there monitoring any questions there. So it's not just a one-way communication. You are able to ask those additional questions. Also want to give a good plug for our coach program as well. So if they want to connect individually with a coach to get some of these answers, we do have that available as well. So our next question says, are there any income or asset limits to receive VA caregiver benefits?
Not that I am aware of, because as a VA, the VA qualifies for those. Um, there may be, that's going to be part of the questionnaire that both the caregiver that's living in home with the VA person is going to have to submit that information to the VA. I have not personally helped anyone with that particular application process. I've done a lot on the other side. But I'll tell you what, I will look into that and I will supply that information on a slide when I find that information out. So when you get the slide, it will be updated with that information.
Okay. We got a question that just came in about becoming a member of the financial support group. Do you want to just talk about getting into our Connect program and also the coach program?
Okay, so if you're to go to healthtree.org, then you can put in your disease and if you go to our community, the community will link you to our Connect sites. And there's different Connect sites for different diseases, CLL, multiple myeloma, and the financial Connect site that I was referencing earlier. You go in there and you can sign up. And it's a very, very quick, easy process to sign up for it. And you'll get that information feeds all the time. You can sign into your 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 through your email address anytime, day or night. And it also, if you have not signed up at all for healthtree.org, I really encourage you to HealthTree.org because financial resources is only a small fraction of what HealthTree provides to our community, for our blood cancer community. There are so many groups to talk to people. There are opportunities for you to assist other people or just to be, I don't know, just to be part of the community where you do feel like part of the community, you feel like part of the family. We have information about your specific disease to help educate you on labs, on some of the latest research, upcoming events that you can participate in. There's so many different opportunities for you to educate yourself, to better yourself and your family that HealthTree provides you. And it's not a one-off. You can talk to us, get a coach, get more than one coach, and we can provide resources throughout your journey. And it's not, it could be 1, 2, 3, 4, 5 years, however long you want us to participate in your life. And we're all honored to do that. It is truly people are giving to help find a cure for all these blood cancers. And there's all the resources out there, the information, the opportunity to participate in person in so many ways that will only enlighten your life. I promise you, it'll enlighten your life.
Thank you so much. One thing I love about our Connect program is it's a social media platform, but you don't get all of the stuff that you may not be wanting to, consume right now. It is strictly just for those topics, and it keeps it very focused and centered on the information that's important to you. So I think it's a wonderful program.
And we talk
Um,
a lot too, Cindy, about financial resources based on care and things the drudgery you have to go through every day when you're having illness. But we also have financial resources out there if you want to go to camps. You are a family member, and these camps are, for the most part, some of these are free, or accessing professional sporting events where you can get discounts or perhaps free tickets. We have a coach who is very good in finding free resources, and he shares those. You might be able to go to a Super Bowl for super cheap. I mean, there's so many things out there that cancer patients aren't aware that are available to them. Travel to and from your treatments if it's out of state. There's so many things available. Entertainment for theater, for opera, for all these things, orchestra, things I love, that you may not be aware out there for like entertainers if you want to go to an event and listen to an entertainer, there are programs and resources and grants and gifting that are available that you may not be aware of. It's not all about, treatment. There's a lot of other things. Our life, like my husband said, is only a portion of who you are. There's a other part of life that's so important with keeping up with to even make yourself healthier.
Absolutely. Thank you so much. I loved earlier your reminder, specifically for our care partners, to take a break and take care of yourself. And I think that's another part of the community is just that reminder that, we all need to take care of ourselves and keep that bucket full. So thank you for that. Perfect. Think we've gotten through all of our questions for today, so we will go ahead and just close out. Again, I just want to thank you, Diana, for sharing your time and your resources with our community and for putting together these programs. I really greatly appreciate it. So thank you so much.
Thanks to all you guys.
All right. So as a reminder, as you leave your session today, we'd appreciate you taking the 2 to 3 minutes to fill out the survey about your experience during today's event. On the screen, I've got a few of our upcoming events. May is pretty packed with events specifically for our myeloma community. I've got some of our myeloma events here. Of course, we've got events for our other blood cancers as well. We've got a link that we'll put in the follow-up email so that you can sign up for those events. Within those events, we do have some of our in-person events. This is one of our new initiatives. It's called Connect to Cures. This is the opportunity to meet with other blood cancer patients like yourself, meet with specialists, and also meet with others in the community to get their resources, to learn about their programs. So if you are in or near any of the cities that are on the screen, take note of the dates and jump on over to our website and register to participate in those programs. We also are looking for people to distribute flyers if you're looking to help out in that way, and also looking for people who want to have tables to talk about their own resources that they have available within those communities. So if you have any questions, please don't hesitate to reach out. We'd like to again thank our sponsors, Pfizer, Adaptive, Cura, Johnson & Johnson, GSK, AbbVie, and Amgen. And lastly, I just want to say thank you again. I've got my email address on the screen. If you have any questions or if you just want to reach out and talk, please don't hesitate. I love getting emails from our community.